The GPS DairyCAST features the high-value insights of the GPS Dairy Consulting team's trusted advisors and the owners and managers from the elite dairy farms they serve. These conversations deliver on the GPS Dairy Consulting promise to inspire change and grow leaders.
Hello and welcome to the GPS DairyCAST. I'm Peggy Coffeen from the Up Level Dairy Podcast, serving as your host. And on this GPS DairyCAST, we are coming to you in the 2024 GPS Leaders Forum. And joining me for this episode is GPS team member King Hickman, as well as featured speaker from the conference, Dr. Godden of the University of Minnesota College of Veterinary Medicine. And she presented here today on the topic of antimicrobial use. And how much are you really spending to control mastitis? In this conversation, you are going to hear the highlights of Dr. Godden's presentation, including why we should care about antimicrobial use, how they should be doing this judiciously, and what types of tubes and treatments work best to use in your herd, and how those can bring about economic benefits as well as animal welfare benefits. Enjoy this conversation with King Hickman and Dr. Sandra Godden.
All right. Well, Sandra, thanks for joining us on this DairyCast. You just gave a presentation at our Leaders Forum on antimicrobial use as it pertains to mastitis treatments. And one of the things that struck me was the questions you asked pretty right up front. It was like, well, why should we care? So could you maybe just explain a little bit, why should we care about our antimicrobial use on the dairies?
Well, mastitis, in spite of the dairy industry making great progress in reducing somatic cell counts, reducing the prevalence of mastitis on farms, it is still the most common infectious disease we experience on farms. Maybe between 20 to 40% of cows will experience a clinical mastitis event during a lactation.
Okay.
Almost 30, as high as 30% sometimes will experience subclinical mastitis. And because it's such a common disease, it is also the most common reason we use antibiotics on farm. So why should we care about that? We want to enhance antimicrobial stewardship for a number of reasons. Use less drugs, use them more appropriately or prudently. The first reason why we should care is to improve consumer confidence in the safety and the quality of the product that we produce. Perception is reality, as you know, and whether they've got their facts straight or not, if the perception is, and it is from a lot of people,
Right.
that we have antibiotic residues in the milk that we sell, and that's not true. The antibiotic use on farm is going to promote antimicrobial resistance, and that is certainly always a risk when
Right.
we use drugs. So improving consumer confidence is one reason why we want to enhance stewardship. Other reasons are to enhance the producer's bottom line, frankly.
Okay.
And there are a number of things that feed into that. One is simply if we use less antibiotics, only when needed, that's less tubes used, that's less milk discarded, and that saves a significant amount of money for the producer. If we use less antibiotics, that also reduces the risk for residue violations, which hopefully are a very,
Right.
very rare
Yep.
thing, but still real risk. We reduce the risk of promoting antimicrobial resistance developing in future, should that happen. So bottom line, it's just going to benefit the producer's economic bottom line.
Right. So there's a lot of reasons to practice antimicrobial stewardship.
Yes.
The consumer acceptance, I think, gets bigger and bigger all the time. It's just, we can't ignore it.
I agree.
Yeah, we have to keep doing that. So you mentioned the economic part about it. What does even just a case of mastitis cost the producer roughly?
Yeah, so I presented a little bit of data, just down to what the individual case costs. Well, there's lots of different estimates. There's one estimate that says a case of mastitis is going to cost, I think it's roughly $73 per cow in the herd per year.
Okay.
That's averaged across all cows in the herd, not
averaged
just
across the
cows
herd.
that have clinical mastitis.
Because a single case of clinical mastitis costs much
So
more
a
than
clinical
that.
case costs more than that, correct.
Right.
So to answer that one question, what does a clinical case cost? Discarding or not including the culling risk or repro failure down the road or longer term outcomes, but just that little episode that we have to treat and address if we treat, that can cost anywhere from $80 up to close to $300 per case. I think it's averaging around $200 per case according to some data from a Wisconsin study by Pam Ruick. Let's say it's close to $200 on average. The majority of that is from discarded milk.
Sure.
And then additional costs come in with the use of intramammary products versus not.
Treatment costs.
Labor, occasionally systemic therapies. If she's systemically ill, she's going to need some
Right.
extra supportive care. So, yeah, an average case is going to be just a smidge under $200 per cap. But again, there's a lot of variation from her to her because her are using very different protocols
Right.
for one another.
Right. So it pays to try to prevent mastitis. Right?
Agreed. Yes.
Right?
Yes.
It's-
And the focus of my talk, because I was asked to talk about
Yeah.
treatment and
Right.
reducing treatment costs, was on therapy. But prevention, you're absolutely right. Prevention is far preferred, investing in preventative practices so that we never create that case, so that we don't have to have the discussion about intramural
Yeah.
therapy or.
Yeah. But unfortunately, we do have to treat
Mm-hmm.
occasionally, right?
Correct.
So what are some of the strategies that we can use in that treatment decision to really help us decide whether we need to use antibiotics and at what
Right.
level and at what?
Right.
So if would you divide that into treat a case of clinical case or a subclinical case versus like dry treatment would be another more preventive type?
Sure. Well, there's two different periods of time when we want to think about this question differently. So
Okay.
we'll put dry period management aside for the moment.
Yep.
And we'll just talk about clinical cases that occur during lactation. It's a stepwise decision-making process, ideally. The first decision to be made is just to look at the cow herself and her history and ask questions like, first of all, if she's toxic, is this a severe case, in which case
Right.
she needs supportive care regardless of our decision on use of an intramammary product, yes or no. So we'll give her, fluids, anti-inflammatories, maybe systemic antibiotics. That's the supportive care that is indicated for a severe case. But now we want to get to the question for mild or moderate clinical cases, do we use intramammary therapy? And again, so back to the cow, we want to look at things like, is she a chronic, yes or no? So looking at her somatic cell count history or her clinical mastitis treatment history, if she's had multiple flare-ups or, perpetually high elevated cell count, she is a chronic and she is less likely to cure, whether we put drugs in her or not.
Right.
She's not likely to cure. So cut your losses and manage that case differently. And that might mean segregating her so that reduce the risk of spreading that to the other cows,
Sure.
and then culling her at the earliest opportunity.
Whenever,
Yeah, whenever. Another decision, or a thing to ask about the cow is, well, first, is she chronic, yes or no? But second, does she have other strikes against her that are going to result in her leaving the herd sooner than later? Because, like we talked about earlier, if it costs, let's say on average, almost $200 to treat a
Right.
clinical case, are we going to recoup that money, or is she going to leave the herd before we recoup the money? So she's got low production, reproductive failure, lameness, or other health problems that are going to mean she's going to leave the herd sooner than later. That would be another reason not to invest in an expensive protocol in trying to treat this cow. Another consideration is if we know the bug, and that's kind of the next decision to be made, is if we know the bug that's causing the infection and it's not something that's going to respond to antibiotic therapy, then again, we're not going to use an intramammary product. So examples of that would be a chronic Staph aureus, back to the chronic question, or infections like Prototheca, Mycoplasma. They're just not going to respond to antibiotics.
And how do you determine that?
Yeah, so that gets a little trickier. The chronic Staph aureus, if we've done prior cultures on
Okay.
prior flare-ups, hopefully we
We
would know that
already know.
information. If we didn't have prior culture information, but we knew it was a Staph aureus herd because of bulk tank surveillance, like monthly bulk
Mm-hmm.
tank cultures, hey, we know Staph aureus is in the herd, or hey, we know Mycoplasma is in the herd,
Right.
then we are going to look for that a little harder culturing this case, and you may need to send your milk sample off to a reference lab that can do Mycoplasma because that's harder to do on farm. We're going to look a little harder for those
Okay.
contagious pathogens if we know it's in the herd.
So you've taken the look at the cow and now you've decided, yep, she's one that we need to consider
Yeah.
doing a treatment.
Yep.
Then the next step, would that be to culture to?
Yeah. So she's passed our first test, and we decided she's not a chronic. She's worth considering
Yeah.
for intramammary therapy. Ideally, the next step is to do a rapid culture of the milk. It could be done with an on-farm culture system on farm, or a rapid culture in your local clinic or a local reference lab that's set up to do it. And then what we want to know is what category of organism does she have an infection with? We don't necessarily need to know the species, but if we could figure out, is this a gram-positive infection, then most of the time we were going to recommend intramammary therapy for gram-positive infections. However, if we were to determine that it's a gram-negative infection, most of the time those do not benefit from intramammary therapy. One of the main reasons for that is E. coli, for example, one of our more common gram-negative infections, has a really high spontaneous cure rate, 90 to 95%.
Yeah.
The immune system deals with it very rapidly on their own, and there's no added benefit from putting an intramammary product in there.
Yeah.
So for most gram-negatives, we're not going to benefit. And then the other common outcome from these cultures is no growth. Very frequently, 30-40% of the time, it varies from herd to herd, you're going to culture milk that is clinically abnormal. She has mastitis,
Right.
but you get no bacterial growth. And the most common reason for that result, we believe, is that, again, she has already dealt with the
She's
infection.
already dealt, yeah.
And so obviously if her immune system has cleared it, we don't need to put product in there. And back to Pam Rueg's work, she's done some really nice randomized clinical trials in those no growths, treat or no treat. And there was no benefit of the treating. The future cures and future performance of that cow was the same.
Either way.
Treat or no treat. And the same was true on the whole for gram negatives. So if we could do rapid culture either on farm or in the clinic and determine that it's a gram negative or a no growth, I would say do not treat that case with intramammary antibiotic.
Okay.
If it's a gram positive, we will.
And that test takes how long, the rapid test? Is it a,
It's 1 to 2 days.
Okay.
Some organisms grow up very quickly, like within 12 hours
Yeah.
you've got growth, and others take a little longer. It might take. So what we do is we suggest you sample the cow the day she's detected.
Yep.
You plate the milk, incubate it overnight, read the plate the next day. If there's growth, you interpret it and you make your decision. If there's no growth, you incubate it one more day for 48 hours total, because there are some streps that take a little longer to grow up.
yeah.
But that brings up a kind of an important point. Some producers get nervous about delaying that treatment
Sure,
decision
yeah.
for that 1 to 2 days while they're waiting for this culture result. And what we've learned, multiple studies have learned, is there's no detriment to delaying the treatment decision.
Okay.
The cow's future performance in cows that we delayed that decision 1 or 2 days is no better or worse than if we treated her the minute we
Okay.
found her. So there's no penalty for that delay. So we're going to use rapid culture systems to make a treat or no treat decision. Gram positive, yes. Gram negative or no growth, no. Then the last decision to be made is, okay, I've got a gram positive, so what drug will I use and what protocol? Basically the duration of therapy.
Okay.
And there's where short duration therapy is preferred. So if the product is labeled for 2 tubes 12 hours apart, or 2 tubes 2 days, one per day for 2 days, use the shortest duration therapy possible on label.
It's important.
Yeah.
Yeah.
Because extended therapy gets you, for most infections, doesn't get you any better cure rate. And all it does is add to your cost, because one, you use more tubes, but number two, every time you extend the duration of therapy, you significantly increase the days of discarded milk.
Got it.
And the discarded milk is the major cost associated with treatment costs.
Okay,
It's
yep.
the major source of economic loss. So by using short duration therapy, we can minimize that economic loss.
So that handles kind of the clinical case.
Yeah, yeah. And if we take that approach and selective, rapid culture systems to make those treatment decisions, we can reduce antibiotic use. It's going to vary from herd to herd, but at least 50% reduction. It could be between 40 to 70% reduction in antibiotic use, and then associated gains because of less milk discard
Sure.
that goes with that. So that would be like the major thing that we could do to enhance antimicrobial stewardship and reduce treatment costs during the lactation period for clinical
Yeah.
mastitis.
Make your feed center a profit center. Feed Fit is an innovative, module-based, and collaborative initiative from GPS Dairy Consulting, which provides the framework and resources to understand the financials, trace the inventories, and track the KPIs of your feed center. By implementing the expertise of your GPS consultant, modules are strategically executed with the goal of continual improvement in the efficiency of your feed center. Take the science of nutrition to the reality of milk in the tank with Feed Fit.
To learn more, ask your GPS Dairy consultant or look under the Education tab at gpsdairy.com.
So then we can move on to dry cow therapy. And you've talked a lot on this over the years. I mean, you're very well versed on this one.
We've done a fair number of
And
studies
it's
here.
selective dry cow treatment.
Yeah, so I guess that's one of the things I talked about with the producers. Historically, we've used blanket dry cow therapy, and in the 1970s and early 80s, that was, and even prior, that was justified. We had historically a high prevalence of things like Staph aureus and strep ag in our herds. We had a high prevalence of infection at dry off. We didn't have good diagnostic tests to make decisions about, is this cow or quarter infected, yes or no. We didn't have teat sealants during the dry period to protect against the infection. So historically, blanket dry cow therapy was a very good idea, and it did a lot of good. But over the decades, we have gotten better and better. The majority of herds now have no strep ag, very low prevalence of Staph aureus. We now have the teat sealants to help protect during the dry period. We now have diagnostic tests that have been validated that can be quickly and easily used to make decisions about whether or not this quarter or this cow is likely infected to dry off. So we have all the tools in place to now make selective treatment decisions as opposed to blanket. And so what selected means is we're going to try to, either at the cow level or the quarter level, decide if this animal or quarter is infected. If it is likely infected, then we will give an intramammary antibiotic to the cow or the quarter at dry off as we used to.
Yep.
And we will follow up with a teat sealant. But if she is not likely infected, then we won't use intramammary antibiotics. We will just use the teat sealant.
Okay.
It's a significant opportunity to reduce drug use, to save costs, to enhance antimicrobial stewardship, but still maintain the same future production potential, udder health. Properly applied, it's equally successful to blanket dry cow therapy. There are two approaches producers can use. The easiest one and the most cost-effective one is an algorithm-based selective approach, where producers are using, if they're on test, if they have cell count data, they're using the cell count data from that lactation and or the clinical mastitis events to make the decision at dry off, is she likely infected, yes or no. So if you've got those records, it's a very simple thing to plug that into an algorithm. It spits out a very simple thing to plug that into a dairy count 305. There's a report, debul, and then whatever thresholds you want to use to make treatment decisions. It's really simple to use. And in our study, in our hands, when we did our randomized trial, by using the algorithm-based approach, we reduced drug use by 55% as compared to blanket, but had the same future health and performance for the cow. And we saved over $7 per cow at dry off because of the tubes that we did not use. Wow. So that's algorithm, and that's what I would recommend for most people, assuming they have the sub-count data.
Okay.
If you weren't on test, if you didn't have sub-count data, then you could use a rapid culture system, applied at either the quarter level or the cow level, and they have also been proven to be equally effective. They will also reduce drug use by about 55% if applied at the quarter level. Unfortunately, they're a little more work because you have to go and sample the cow a couple days before dry off, plate the milk, incubate it, read the plate. So that's, extra hassle, labor, cost. So while it works biologically, it's not quite as cost effective. It was about $2 benefit per cow dried off for culture-based versus the $7 for oven, because you had extra costs invested in running it. So it's there, it will work, but for most herds, if they're on test, I would just use the cell data.
Just the data.
Yep. Do
you make any recommendations on type of treatment, dry cow treatment?
That's a good question. That's come up over the years.
I'm sure.
'Cause we have several different tubes available in the U.S. marketplace that are approved for dry cow therapy. Trade names people will be familiar with like Quartermaster, Dry Clocks, Tomorrow, Spectrum S Dry Cow. They have different costs. Obviously, some are cheaper, some are a little more expensive. They have different meat and milk hold times. A couple of Spectrum S Dry Cow and Dry Clocks have a 0 withhold after calving. Tomorrow and Quartermaster have some withhold post-calving. But they're all labeled for gram-positive Spectrum Ev activity.
Got it.
So there are cost differences, some label differences between the products. So The question has come up over the years, is this tube as good as that tube? Can I use a cheaper tube? So over the years, we've done 2 different large, multi-state, multi-herd, randomized clinical trials comparing these products, comparing efficacy. And bottom line is there's no difference in efficacy. They have really good, equally high cure rates. Cure rates are around 90% for all of these products, these 4 products that I mentioned.
Yep.
The future better health and production potential and performance in the next lactation is virtually identical among these products. So instead of picking on efficacy, because that's the same, that frees producers up to pick on other characteristics like maybe cost.
Right.
Or maybe they're concerned, they want a different withhold time, yes or no. So they could pick their product based on those other attributes, but don't worry about efficacy because they're all the same.
So then as we look at the selective dry cow therapy, is there a certain segment of herds that you would recommend that for? Is there a criteria that they need to look to say, this is something that I could take advantage of on my dairy?
Yeah, because it's not for everybody. There's some herds that wouldn't be appropriate, herds with a high prevalence of infection at dry off. Probably still should just do blanket. But yeah, herds eligible for selective, they should have a relatively low average cell count, like under 250,000 over the course of the year. They need the test data, obviously.
Right.
We suggest at least, 8 tests per year, so you've got fairly frequent cell count data to look at the last few tests before dry off, and is she high or not. We need to have hopefully no strep ag and a low prevalence of Staph aureus in the herd. If they had a high prevalence of contagious pathogens, we'd want to get that under control first. They need to have good hygienic practices when they're doing the dry off procedures, the infusions in the parlor, because if we're choosing not to treat a cow or a quarter, but we're going to put an internal T-sealant in there, we need to be especially clean about it. Otherwise, we could introduce crud and cause
and then
problems.
seal it up. Then.
Right.
Yeah.
People need to be well trained and properly, use proper infusion techniques. And then apart from that, just have the ability to manage the records, the protocols, the training, and then monitoring the outcome. So again, working with the veterinarian on those aspects. If herds can manage that, they should be in good shape for this. Oh, and I guess last thing would be, and they routinely use a teat sealant.
Okay.
For selective dry cow therapy programs to work, you must use a teat sealant routinely
That's
to protect the
non-negotiable.
That's non-negotiable.
Okay.
Correct.
Got it.
A few years ago, I looked at Minnesota DHI herds and just kind of asked the question of the data. So what proportion of Minnesota herds would be eligible based on just cell counts, and what proportion of cows? And that was 4 years ago, over 50% of herds, close to 60% of herds, and within those herds, close to 80% of cows would be eligible for selective dry cow therapy.
Wow.
Just based on cell count data alone. So that was 4 years ago. So today, I would expect that to be even higher. So bottom line is the majority of herds are right now in a position to do this if they wanted to.
Yeah. So bottom line, what I took away is that mastitis is still the most commonly treated disease on the dairy. And it's probably the most commonly used antimicrobial therapy to treat it. So it's
the most common reason we use drugs.
the most common reason we use the drugs. So it really comes down, we want to practice good stewardship, right? So what I took away from that is that, there's that comfort to the consumer that makes them more comfortable that we are doing as much as we can to reduce or to manage antimicrobial use on the dairies.
Assuming we get that message out to consumers.
Well, that's a whole nother podcast.
Yes, it is.
But the other thing is it can be a huge economic benefit to the dairy producer to start to practice some of these things.
Exactly.
And to me, listening to you walk through it, it's not that difficult.
No.
It's a pretty much cut and dried
We
recipe.
know how to do
cookbook
it.
and-
These systems have been studied, they've been validated.
Right.
We know that they work. The producer just needs to have the conversation with the veterinarian, decide if this program right for them.
Yep.
And then the veterinarian can work with them to develop protocols, do the training, set up the systems for monitoring, making sure there's protocol compliance and monitoring successive protocols, making sure that the system is working the way it should. But there are some huge opportunities for producers to save some money and do right by their cows.
That's a great message, I think. I think our producers really appreciate hearing that, I think some of them heard it before, but to walk through it as sequentially as you did, I think it's a no-brainer. Let's give it a try. Hopefully that's what we'll get out. So thanks for joining us. This was great.
Thank you. It's my
Yeah.
pleasure.
You just heard from King Hickman from GPS, as well as Dr. Sandra Godden from the University of Minnesota. I'm Peggy Coffeen, and thank you for listening to this GPS DairyCast.
The GPS DairyCast features conversations that deliver on the GPS Dairy Consulting promise to inspire change and grow leaders. If this GPS DairyCast has you looking for more ways to become an elite dairy producer, find more information in our show notes on how you can add a GPS advisor to your team.